Hello, good morning, class. Can you hear me? If you can hear me, kindly comment in the comment section that you can hear me. Hello, can you hear me? Okay, so thank you very much, Toby Ishola. You can hear me. All right, so today we are going to be talking on sources and classification of drugs. Now, virtually, um, this is more like a revision class. However, what I'm going to be sharing here today are going to be very, very important in your exam come, I think, August. Just kindly put in the comment section, let me know when is your exams for the two classes. I think there are supposed to be two classes taking this lecture. We have third third cohort nursing and second cohort midwifery. The reason being that the reason why I merged them together was because I felt that um, this is more like a summary of what I've taught both classes. So I think both of you will enjoy the privileges of being in this class together. So I would like to know when your exams are starting. So as soon as you remember, you let me know. Okay, please. Is that Emefe Fortunate? Is that nursing or midwifery? Let me know. Emefe Fortunate, third cohort nursing. Okay, July 31st. So the midwifery class would come to would speak about their midwifery um, timetable for exam. All right, so let's go on. Let's go on. Would hope other persons join us. Please, the time for attendance is not yet. Anyone who writes their name right now will not be. It's an invalid attendance. I'm gonna mention the time for attendance during the course of this lecture, and as soon as you hear that, you write your name. This time around, write your course nursing first, then your name, then your mat number. All right. So Esther Chinelo, please do not write your mat number. This is not the time for attendance. Thank you very much. What I want to see is if you have any question, you drop the question during the class as the class is going on, not the time for mat number. Thank you. So sources and classification of drug is what we are going to be studying this morning. We are going to be checking to see what are the classification of drugs that there are, and then what are the sources of drugs that we have. All right, so this is the course outline for today's class. I'm not talking about sources of drugs, classification of drugs, then classification according. Okay, there's a classification according to their function, and there's classification according to their formation. Now, what are drugs? First of all, a drug is any substance that can be used for medicinal diagnosis, cure, treatment, or prevention of disease. So a drug is any substance that's used for diagnosis, cure, prevention of diseases. Okay, so for example, if I take water for to prevent a particular disease, water at that instance become a drug. So if you find something like this in your exam, which of these is a drug? Or let me paraphrase and say water. Okay, I can describe an incident for you where water was used, and I will be like, which of these are the drugs that this patient used? A, water. B, whatever I feel like naming. Okay, but is that description that I give to you in that example, um, water was used to prevent, to cure, or to treat? Okay, then water becomes a drug. Blessed Priscilla, it's obvious that you have not been in this class. You are not supposed to write your mat number now. This is not the time for attendance. So please, everyone take notes. Thank you. And medicines can be classified into various ways. There's chemical classification, then there is route of administration, then there is the systems effect. All right. Now, different bodies, different profession actually use different means of classification. However, in pharmacy or in pharmacology, all these three means of classification are very important because sometimes you need to know the chemical properties of drugs. Sometimes you need to know how they are administered. Sometimes you need to know what they do, the effects that they exert on that part of the body. Then examples of classes of medicines include antipyretics, analgesics as painkillers, drugs that are used to reduce pain, anti-malarials, drugs that are used to treat malaria, antibiotics, drugs that are used for against live organisms, in either fungi, virus, bacteria, and then protozoas. Okay, then there's antiseptics. All right. So we also talk about dosage form here. Dosage form is the form whereby a drug is be available as either as liquid form, solid form, semi-solid. We have semi-solid form of drugs. I don't know if anyone can list an example of a semi-solid drug that they know. I'll check it in the comment section. Then we have okay, those are the major form: liquid, solid, semi-solid. Then there is aerosols, drugs that are formulated as aerosols, particles. All right, that's there. Also, I didn't add that to the list. Now, yeah, we're gonna go deeply now into sources of drugs. Okay, sources of drugs. Now, number one is plant source, animal source, mineral source, microbiological source, semi-synthetic sources, and what recombinant DNA technology. Now, plant source, that is very, very popular. We already know that most drugs are gotten from plants. Many of us take different types of plants for us to get well. Many of us take different types of plants to prevent a particular kind of disease. Now, some of you know the popular bitter leaf. Bitter leaf can be used for many, many illnesses. Then there is what they call agbo, locally made. It's a combination of different plant parts to be able to treat malaria. So those are plant sources. Those are examples of plant sources of food. Then there is also um, um, animal source. So drugs that are taken from the parts of different animals. They are sometimes they can be the bones. The bones can be used. Sometimes they can say you have to eat a particular part of the animal to get your your cure or your treatment. Okay. Now sometimes there is superstition to this, but however, what we are going to be talking about in pharmacology is not just the superstitious aspect or the other types of aspect. We are going to talk about sources. That is how the drugs we find in our pharmacy, in the hospitals, how do we get them? Okay. So how did we get them from the beginning? Okay. Then there is mineral and earth sources, for example, the sand, the soil, water, okay, the air, rocks. Yeah, all of this they all have drugs that they provide for every one of us. Then there is microbial source, that is drugs that are being gotten from microorganisms. Now, all these drugs that are gotten from microorganisms, they usually are are synthesized, or sorry, are gotten from microorganisms in the first stage, and afterward they are then synthesized in large quantities. All right. Then there is semi-synthetic and synthetic. Semi-synthetic and synthetic. What it does mean is that there is a modification to this drug in the laboratory. For example, if they discovered a particular drug has a cure for HIV and AIDS, okay, and after a while of using that drug, let's say 1 year, 2 years, there is a lot of resistance to that drug. Let's say they checked and see that bitter leaf has a cure, has a treatment against AIDS, HIV and AIDS, and because of mutation of the virus is changing. I'm sure every one of us here know what mutation is. The virus is changing, it's changing form, and then the virus become resistant to that bitter leaf. So what they do in the lab is that they now go to the lab, they leave the nucleus of the drug. The nucleus of the drug is intact, and they change some of the positions of the other atoms or other elements around the nucleus. That is called semi-synthetic drug. That is, the nucleus of the drug is intact, but they are changing the things around the nucleus to be able to make the drug resist whatever resistance that the virus is giving to it, or to make the drug simply better. Another example is, um, let's say they discover that cashew nuts, we all know cashew nut has an effect against hypertension. But when patients take this drug, they become drowsy, heavily drowsy. They start sleeping. They sleep so long. So what they do in the laboratory is this: the pharmacist go and say, what is causing the patient to sleep so long? So they look for any any group of elements around this drug in the structure of the drug that can make people drowsy. Then they change it to see if that drowsy effect can be reduced or eliminated. They want to maintain that this drug have effect on hypertensive patients, reduce hypertension, but also they want to reduce the side effects. So what they do is that they now semi-synthesize this drug. That's, they are playing with the original drug. They're just trying to play around the original drug and see if they can get a better. Remember in semi-synthetic they just play around the nucleus. The nucleus is the same. All right. Then fully synthetic drug. That is, this time around, they have seen this drug, but somebody feels or something happens that they feel that if I change the nucleus of this, if I change the nucleus of this drug is going to have a better effect. So that's what happens. So there's either semi-synthetic or fully synthetic. Synthetic, they change the nucleus. They actually, in the laboratory, the scientists actually change everything about that drug. So they eventually discover, or they eventually make a brand new drug. Okay, so in synthetic, in synthetic, what happened is, in synthetic, what happened is that they change the nucleus of the drug. In semi-synthetic, what happened is they change what, the side chains of the drug. That is, they are changing the side elements of the drugs. All right. So so that is that for those two differences. All right. I believe we understand those differences, and we know how it is. All right. Now, a better explanation of that semi-synthetic and fully synthetic is that sometimes, if you check, those of you that know how to drive cars or know some things about cars, we can understand that. Thank you, Blessing. Blessing can hear. So if you can no longer hear, let me know. If you can hear me, please let me know. So, all right, it's better. Thank you very much. So, those of you who know about cars, you know that there are some cars that they call hybrids. That is, the engine of the car is that of is for example, how do I put it now? They can get the engine of a Lexus, they can put it in a Toyota, and then that car will be referred to as a hybrid. Why? They just changed only the body of the car. They left the engine. Do you understand? They changed the body of the car. The engine of a Lexus is there, but they changed the body to a Toyota body as a hybrid. Now, if for example they change the engine and change everything, you are talking about a very brand new car, a different kinds of car entirely. All right. So that is that for that. Then the recombinant DNA technology. This is the use of DNA. They just remove a structure, a part of the DNA, and impute a new strand, and try to see how that can replicate and produce a brand new drug. That is the whole idea of recombinant DNA. So I just use this table to run down. We are going to go through this whole section now. It's not much slides here. I think I just have about 20 slides here. This is number 4 or 5. So we have about 15 slides to go. Okay. So plant sources. Now, under plant sources, we have leaves, we have stem, we have fruits, we have seeds, we have different parts of plants. So there are different drugs that are gotten from different parts of plant. And mind you, different parts of plants have different chemicals. So sometimes some people that usually take India hemp, the leaves, they will tell you if you smoke the leaf, it's safe. If you smoke the stem, you will get high or you can run mad. If you smoke the seeds, so it shows you that different parts of the plant have different concentrations of different chemicals. So so that is the idea Now, an example of a drug that is gotten from leaf is digitalis purpurea. Then we have also another drug that is gotten from flowers. Flowers, we have Papaver somniferum. Papaver somniferum is what was where they discover morphine from morphine. Okay. Then from fruits, we have calabar beans. How many of you know calabar beans? What do you popularly call devil beans? I think so. Now, it has phytosigmine, which is a cholinomimetic. Now, that drug is actually used to kill, to what do you call it? To paralyze. It's used by hunters to paralyze their prey. When they shoot them with the arrows, they become less. They don't move very well because of the effect of the drug. Okay. Now, then drugs that are gotten from seeds, we have Nux vomica, is used as a CNS stimulant. Then we have castor oil, that's castor oil that is used as a purgative. That is if you want to, you want to induce purging in a patient or in a client, you use all of that. All right. Then we have roots, emetine, ipequaha, rawofia, sapetina is used for hypertension. Then that's for roots. Then stem, you see all of these names. Now the back, cinchona, quinine, atropine belladonna, which gives atropine. All of us know atropine here. I say many of us here have done our clinical posting, so you know what atropine is. Then we know what quinine is. We have seen quinine, there are tablets of syrup. It was initially gotten from cinchona barks. Okay. Now many of these drugs now have been synthesized in the lab, but they synthesize them completely. They copy what is in the natural product, so you cannot call them semi-synthetic, because what they made actually was exactly what they saw in the natural product. Okay. So animal sources. Please, under all of these sources, you should at least know one drug and the parts that they are being sourced from. Okay, just in case you see that question in the exam. All right. Then animal source. Somebody's asking what devil beans is for. All right. Animal source. Pancreas. They get insulin from animals. All right. I think pigs too. Yeah. Yeah. The urine of pregnant women gives HCG. It's used for treatment of fertility. So there's a place where they collect the urine of pregnant women for treatment of fertility. That does not mean that you should start drinking pregnant women urine. I'm begging you this class. Thank you. Then thyroid is also gotten from sheep. Coliver oil is a good source of vitamin A and D. Then blood of animals sometimes have been used to prepare vaccines. Okay. Then we have mineral sources: iron, mercury, zinc, gold. You know, we have zinc tablet. All right, zinc tablet is zinc supplement, and it's a natural occurring mineral. Then we have semi-synthetic and synthetic sources. So semi-synthetic, we have emetine, bismuth, iodide, which is I told you that. Look at what is here, where the nucleus of the drug from the natural source as well as chemical structure is altered. All right, we say it is synthetic. But when it's not, when the nucleus is not altered, we call it semi-synthetic. All right. Example of semi-synthetic, we have apomorphine, estradiol, ampicillin, and testosterone, which is used to treat male infertility. So we have microbial sources. Penicillin is also used is from fungus. It was gotten from microorganisms. All right. Then we also have streptomycin. Streptomycin is an antibiotic that is almost fading out right now. It's gotten from actinobacteria. Then aminoglycosides too are gotten from micromonosporas. So that's that for that. Then recombinant DNA is gotten from replication of bacteria, viral, or plasmid DNAs. And I think, okay, so that's much of the class, but we'll just do a brief classification according to function: analgesic, anti-inflammatory, antipyretic, anti-ulcer, antihypertensive, hypoglycemic drugs. Now, all these drugs, you're going to study every one of them in your next semester, so I will not necessarily focus on this classification this semester, because this classification form a bulk of your next semester job course. I'm talking to the nursing student right now. The midwifery students, you have a whole different lot of drugs to talk about, but I'm going to be talking about a few of all of these. Okay. Then we have antiviral drugs, antibiotics drugs now. Now, analgesics are used for pain. Anti-inflammatory are used to reduce inflammation or eliminate it. Antipyresia are used to reduce temperature. The anti-ulcer are ulcer healing drugs. Antihypertensives are drugs that bring down the hypertension, blood pressure. Hypoglycemics are drugs that bring down the sugar level. Antineoplastics are anti-cancer drugs. Antihemicides are drugs that are used for worm infestations, protozoa and worm infestations. Antibiotics are used for live organisms such as bacteria, virus, um, fungi, and the rest. The antiviral are used for against viral infections. Okay. Then these are examples of all of these classes of drugs here: antiviral drugs, antihypertensive drugs. Then we have classification according to their formation. What do I mean by formation? That is, why or how has this drug formed, or why were they formed? Okay, so we have benzodiazepines. Many of us know what benzodiazepines are. They are anxiolytics. They are used to reduce, eliminate anxiety, and they calm the body to cause sleeping. All right. Then we have cardiac glycosides. Cardiac glycosides are drugs that act on the heart rather, help to control blood pressure, help to control heart rate, and the rest. Then according to the information. So um, I will give the next 5 minutes for us to write our attendance. So everybody that is online now, I think I'm seeing 27 persons in this class. Just use the next 5 minutes to write your attendance. If you have any question, you can ask, and I'll be able to respond to it right now. So write your attendance after now. We can close the class. Hello, can you hear me? Faith Germany says she cannot hear. Can anyone hear me in the class? Let me know. Okay, Annabelle is writing her attendance. All right. So please, the next 5 minutes. This is 9:09. We are going to be writing our attendance till 9:15.
I've done that part. This is the part that has to scare me.
Hello, I can see some persons are writing attendance for orders. Please, that is not allowed. Fit Germany, I can see you're writing Osage, Osaga, Walter. Please just your name because I'm going to compare this list, okay? Just your name and their attendance, okay? Thank you very much. All right, so we have 1 minute more for that. Then, if you have any question, you can reach out to me. I'm going to do another revision for every one of us during when I meet you. Hopefully next week or not next week, maybe next 2 weeks. To do just a roundup so that the revision could be closer to your exam. It will help every one of you recollect and remember what is required of you for your exam. All right, so thank you very much, everyone. This is 912. Um, Anyone who missed the class and needs to needs to know or check what we have done should simply rewatch the video. All right, thank you very much. Bye bye.